Hi, I'm Dr. Gary Sachs, and I'm here with Theresa Schmidt. We're both from Sachs Wellness Center, and today we're going to talk a little bit about being prepared for going back to school and, being around a lot of other kids, and just sort of what we can do to really promote the best health that we can in that sort of change in environment, I guess.
Yeah, the best support.
Yeah.
The best support, I think.
Yeah.
So I think really what everybody is asking about now, what do we do? How do we be prepared? What are the best things without doing 20 things?
Mm-hmm.
You can get a list of 20, 30 things that you should take, to be prepared. But we want to keep it as simple as possible. We want to keep it, what are we already doing? What should we already be doing?
Yeah.
And then is there anything else we need to do to tweak it?
Sure.
To get ready. And I'm just going to put out there first, and I don't know if you feel this way, but I feel like vitamin D is number one.
It's like the essential.
Yeah, it is.
Yeah.
I really feel like that. Yeah. And I just talked to somebody today, and they're like, oh, I didn't realize that there wasn't some D year round. Mm-hmm. So I just want to clarify that right now. Clarify it. As of September 15th-ish, at the 45th parallel, which is where Gaylord is, there is no more D. You are getting no D. You can go outside in your bathing suit. You are getting no vitamin D. And people, they just need to know that, because if it's cloudy for the first 2 weeks of September, you used it all up. You got to start full blown September 15th, taking about 5,000 IU. Kids, depends on their weight. Anybody that weighs about 100 pounds or more should just go with 5,000 IU of D. So I think that's a pretty basic line, and that is foundational for our immune system.
And we could say, sometimes 5,000's a big scary number. Yeah. That there's no fear with that.
No,
that's still not getting into any type of a mega dose or anything like that. So just want to put that to rest.
20,000, 30,000. Some people are desperately low, and they need to take 20 or 30,000 for a couple weeks just to get it up there. 5,000 is about average.
It's like a maintenance dose.
It's pretty average. Yeah. It affects 3,000 of our genes that we know of. It affects the immune system. Not one person that I know of, but not that I know everything, but that in record, not one person in the world that had a vitamin D level over 50 died of COVID. Mm-hmm. Not one. So that's how important vitamin D is for us. So we've got these kits here, and so to start out, they've got vitamin D. And so if we're not sure when to start, if you've been outside a lot, it's been pretty sunny, then you probably don't need to start until about September 15th. But after that, everybody needs to be on some vitamin D. Would you say that's
absolutely.
We want a good whole food vitamin. Okay, whole food vitamin. I'm not talking about one a day. I'm not talking about the things the gummies at Walmart or Myers, no offense to them, but we just want a good whole food vitamin. And for the littler kids, we've got Catalin chewable in here in the kit for them. The older kids can take the regular Catalin or the Catalin gluten-free, depending on what we find out that they need. I've a lot of times suggested that they take a Thymex. Mm-hmm. Thymex boosts your immune system relating to a bacteria. Now, last couple of years, if people are more concerned, we can do an Immuplex instead. Immuplex leans a little bit more towards viral, a more well-rounded one. But what I've found over the last 15 years is pretty much what's up here in the fall is bacterial. So we want to boost it with a little Thymex if they're going to go to school. So there's some Thymex in there. And we can use Congaplex. There's a chewable Congaplex for the kids too. We also have an essential fatty acid in both kits, and those are chewable for the little ones too. They taste like strawberry, or if we decide to use a cod liver oil or one of the others, they taste like lemon. So very, very good. So the essential fatty acids are, again, foundational. We need them for anti-inflammatory. So if the food hasn't been great, and they're eating some things like macaroni and cheese and pizza and things like that causes inflammation in the gut, the essential fatty acids help counterbalance that. French fries, bad oils, things like that. Yeah. So those help counterbalance the inflammation that gets in the gut, and it can actually get into the respiratory system and the sinus, making people vulnerable to what does go by. Yeah.
So we put together these kits, one for kids 3 to 6 and one for really 7 on.
Yeah,
I guess we could say. And,
because
and we picked, I mean, really, if you're someone that's a patient here, we can test you and know exactly, the different choices you were bringing up. But maybe for someone that's not getting tested regularly, or you just want to do something for your kids at home, we put together the most common, most likely things that you can do that would be safe and very advisable to do.
Yeah, very safe. Good for pretty much any situation. So if you're, like my grandkids, they eat a lot of macaroni and cheese and pizza, like a lot of the kids do, the chicken nuggets, and they're just looking for a real good base to protect them at school. These are great for that.
Yeah.
There's no problem with any of those.
So we're seeing this is preventive. This is maintenance. This is, it might be different if your child is sick. We might, we'd probably need to check, and the dosages might be different, but we have the product and the dosage on there that would be a preventive kind of thing, and we think it'll help.
Yeah, we do. It's really good to have that good foundation just to start with, especially when they're going back to school. They've been just pretty much with family and a few friends all summer. Then they go back into this group of a lot of germs.
Yeah.
And so they need to exercise their immune systems, and this is a really good support for that.
Yeah. Great. So we hope that this information is helpful for you and practical. And if you have any specific questions, you can reach out and call us at 989-732-7000, or you can reach us by website, www.sacswellnesscenter.com.